Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you can help and improve the quality of life of a great number of your future patients. Remember to study the description of this video where you can find a link to free training classes on hypnosis with several free ebooks. The influence of diet in the prevention and improvement of certain diseases. A good diet can, in many cases, avoid, delay, or mitigate the effects of some diseases. So, it is very convenient to list dietary and lifestyle tips, all of them very elementary, in front of any of these diseases. High blood pressure, HBP, excess weight, high sodium intake, alcohol consumption, and smoking contribute to the development of HD. Therefore, whether or not there is HTN, the general population should be advised to moderate alcohol intake, salt and excess calories, eating balanced diets, and giving up smoking. If HTN exists, it should be assessed. The HTN persists despite compliance with this advice. If it persists, the physician should be consulted so that pharmacological treatment can be established. Cardiovascular disease, CVD. The main nutritional factors related to a high level of plasma lipids, modifiable risk factor for CVD, the development of coronary heart disease itself, are fats, in particular saturated fats, should not provide more than 7% of the calories in the diet, and cholesterol, intakes below 300 mg per day, together with a positive energy balance which translates into obesity. As in the previous case, the consumption of balanced diet and the exclusion of certain foods from the diet contributes to the prevention or improvement of this. Likewise, favorable changes in lifestyle, physical activity, smoking cessation, etc. are beneficial. Cancer. Studies assessing the effect of diet on the etiology of cancer are sometimes contradictory. However, broadly speaking, it can be stated that the main factors excess energy and fat consumption, especially saturated fats, lack of fiber, and of foods rich in vitamin A and carotenes, excessive animal protein, high consumption of smoked and salted foods, and deficiencies in vitamin E, vitamin C, and selenium. It is quite another matter what kind of diet a patient suffering from a malignancy should consume. In this case, the type of cancer, its stage, and the nutritional situation should be taken into account, following the indication of his doctor. Diabetes. The diabetic's diet must be as balanced as possible, and not very different from that of a non-diabetic, except for certain foods, those rich in saturated fats and cholesterol and alcohol, following a timetable and distribution, 6 snacks a day, and controlling the quantities, especially carbohydrates. Carbohydrates should not account for more than 50% of the total carbohydrates. Calorie and protein intake should also be adapted. Hepatopathies, cirrhosis of the liver. The objectives of nutritional care are to preserve or improve the nutritional status of the person suffering from them. If there is weight loss, the energy content of the diet should be increased, at the expenses, above all, of complex carbohydrates, while moderating the protein intake, preferably of vegetable origin, without entering into a negative nitrogen balance. No more than 25 to 30% of calories should come from fat, and, if possible, replace normal, longer chain fats with the medium chain triglycerides. Also, give vitamin supplements of folate, thiamine, 12. In the case of cirrhosis, if it is a consequence of alcoholism, it is not protected by nutritional intervention. Osteoarticular diseases. Osteoporosis should be prevented from the period of active growth by providing optimal bone-forming nutrients, especially calcium. From adulthood onwards, special attention should be paid to women with premature menopause, nulliparous women with little physical activity, and smokers, all circumstances that increase the risk of this pathology. Diets rich in dairy products and physical exercise should be recommended in order to prevent the pathology from progressing. It is now recommended to increase the consumption of plant-based foods, as many of the and non-nutritive components they contain appears to improve bone density. In the case of arthritis, being an inflammatory condition, it demands a greater amount of nutrients. In addition, it is often disabling, and this limits food, shopping and preparation, which favors the appearance of a poor nutritional status. Corrected, it is advisable to adjust energy, as if it were an active subject, and increase protein to 1.5 to 2 grams per kilogram, and day and omega-3 fatty acids for their effects on inflammatory pathways. Anemia. Deficient intakes of iron, protein, vitamins, B12, folates, pyridoxine, and C often leads to so-called nutritional anemias. The most common are due to iron and folic acid. Supplementation with these nutrients has to be considered, but also possible chronic blood loss. Poor nutrient absorption and physiological expansion of blood volume that occurs in childhood, adolescence, and pregnancy. Some dietary recommendations or guidelines for the population to prepare a healthy diet. If you're interested in learning more about clinical hypnosis, watch our next video, Self-Instructions for Anxiety. Remember to study the description of this video, 2 free training classes on clinical hypnosis with several free ebooks. If you have questions, add them in the comments area. About this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.